An aneurysm is an area within an artery that has become weaker and over time, under normal blood pressure, tends to balloon outward. The aneurysm can have different shapes, so sometimes it's just part of the wall that balloons out of the side. Sometimes it's the whole artery that starts to expand. It can occur in any of the blood vessels going to the brain or within the brain itself. And what we worry about most with aneurysms is that that area of the wall is weak and can therefore burst or rupture, and that can cause a bleed in the brain. Patients can have major neurologic problems after a hemorrhage. So what we try to do when we discover an aneurysm before it has caused a problem is to try to assess the risk posed by that aneurysm, come up with a treatment strategy that is as low risk as possible, and then put that treatment into place before the aneurysm becomes symptomatic. If a patient arrives having already had a problem from the aneurysm, especially if they've had a bleed already, then it's really very important to have all hands on deck and try to treat that as quickly as possible, because there's a very high risk of having a second bleed once an aneurysm has already ruptured. There are really two possible approaches towards an aneurysm. The internal treatment is endovascular, which means we try to treat it from inside the blood vessel, and that involves putting a catheter up into the blood vessel. We typically go into an artery in the leg. That's a big, safe artery to use. And that catheter is guided up to the vessel in the neck from which the aneurysm eventually comes when it gets to the brain. If we're going to treat it from inside the blood vessel, what we then do is put a second catheter, which is even smaller than the first one, and that goes up inside that first catheter all the way up into the brain. And with the tip of the catheter, we enter the aneurysm itself, and we can then put out into the aneurysm specialized metal coils that are designed in particular sizes and shapes to pack the inside of the aneurysm with the coil as tightly as we possibly can.
In other cases, the better thing to do is to operate from the outside. Think about a balloon. If you're inflating a balloon and there's the neck of the balloon, the little small part that you blow up within your mouth, that's the part where air is getting into the balloon. And with an aneurysm, that's the part where blood is getting into the weak part of the aneurysm. If you, at operation, can find where that neck is, where that narrow part that the blood is getting in, you can put a little tiny clip to pinch off the neck. And what happens is you stop the blood from leaking out where it's not supposed to be, and you close off the little weak spot in the pipe in the blood vessel. So hopefully what happens is normal blood continues to travel through the normal blood vessel, keeping the brain healthy and preventing a stroke. But the weak spot has been pinched off and closed, hopefully curing the aneurysm.
The decision whether to actively treat an aneurysm or follow it is often a difficult one, and many factors go into it. When we discover very small aneurysms, we're more inclined to follow them, at least initially. When we discover a larger aneurysm that makes us more concerned, we aim to treat that faster.
And this is something where having a group of experts all in one spot and people who have seen these diseases before can really inform the decisions we make, so we make the best and safest decisions. While nothing's perfect, we can make them as close to perfect as possible by really leveraging all the expertise we have in one center.